All right, welcome back to Live at 9. It's Wellness Wednesday, and today we're talking about one of the most vital organs in the human body, the heart. Valentine's Day has come and gone, but some may still be dealing with the effects of a broken heart. Broken heart syndrome is a temporary, reversible heart condition often triggered by intense emotional or physical stress. So today we have Dr. Quinn to discuss this topic with us. Good morning, Dr. Quinn.
Good morning.
So is it true that a broken heart can sometimes mean more than just emotional stress?
Most definitely. I have 3 physicians that are ER physicians in 3 different states, and every year we have the same conversation because we keep in touch and we talk, and a lot of patients, not a lot, but at least 1 or 2 per emergency room in these different 3 states will come in on the night of Valentine's Day, which was last Saturday night, and they'll think that they're having a heart attack, but they'll do some tests and they'll rule out that the patient is having something called broken heart syndrome. It's basically a manifestation of emotional response that's just very, very strong. And the same history of all 3 women in the 3 states was that they were expecting a big Valentine's from their significant other, and the significant other had more significant others. So that significant other made choices, and it wasn't the ladies that ended up in the emergency room. And because they learned that they were in a situation where the significant other was not serious with them, their hearts were broken. They were just overwhelmed with grief, and they had all the signs and symptoms we'll talk about. But broken heart syndrome is real and is recognized by the American Academy of Cardiologists.
Wow. Dr. Quinn, some people may have had no idea that is a real condition and a syndrome that you can definitely develop. So let's talk about what some of those symptoms are for this condition.
Right. The individuals that presented to the emergency room had the typical symptoms. They have chest pain, shortness of breath, sometimes lightheaded, and sometimes they even faint. And the deal is, when you look at the presentation, it's the same presentation of someone that's having a heart attack. So what the doctors in the emergency room do is they do tests. They do blood tests for heart enzymes to indicate that there might be a heart attack, and those enzymes are elevated, but then they'll send them back to the back to be further evaluated, and they'll do an echocardiogram, and there's a characteristic finding of the left ventricle, which it balloons out, and that's where the name comes from. It's not really broken heart syndrome, but it's something called Takotsubo syndrome, and it's named after a Japanese octopus trap where it was first identified when it was discovered years ago. And we just call it broken heart syndrome because in America that's easier for us because we're not familiar with Takotsubo and octopus traps. But the take home is it's real and it's something that can be serious. But the way it's ruled out to distinguish it from a heart attack is when they do the cardiac cath, there's no blockage of the coronary arteries.
Okay. All right, Dr. Quinn. So I was going to ask, what the distinguishing factor, but that's definitely important to know, especially to hear that reassuring fact that, hey, you're not having a heart attack, right? Although it might feel like it, this is just broken heart syndrome. Not to downplay this because it still can be and lead to serious implications for your health. But are there ways to treat a broken heart syndrome?
Well, usually what they do is they'll put the person in the hospital for a number of days, and it'll resolve with just treatment that's supportive treatment, like IV fluid, maybe some beta blockers to slow the heart down. But for those that have underlying heart conditions, they're at a higher risk factor of having congestive heart failure and possibly losing their life. So it's very important that you just try to stay away from stressful situations or maybe relationships that aren't as stable. Like if you think the guy is not for you or the lady is not for you, maybe just don't even continue. But don't, but I'm gonna tell you something that's really interesting. When I did my research, people actually suffered this from winning the lottery. Maybe they won $1 million all of a sudden and they just were overwhelmed, and another reason is loss of a spouse or a loved one or a mother or father. Sometimes anything that's super stressful, your adrenaline glands can release adrenaline into your blood, cortisol, and you just get stimulated, and it could, if you are susceptible or have heart condition, it could make it worse, and you could develop this broken heart syndrome. But it's something that we really want to pay attention to.
Absolutely, Dr. Quinn. And do most people fully recover from a broken heart syndrome when they develop this condition?
Well, the majority of people recover, but as I said, if you have underlying heart disease, you are at risk of it having to exacerbate on into congestive heart failure, and then you could eventually lose your life. So with the take-home message, just make sure whoever you commit to, you make sure they're committed to you, and if they let you down and you have heart, palpitations or chest pain, go to the emergency room and get checked out, because although most people end up with just, this reversible disease that reverses by itself, don't risk it, because some people can have a heart attack or they can develop that congestive heart failure. So safety is number one.
Absolutely.
Protect your heart and your emotions, and just realize that it can be serious.